Hi, this is Adam Eliel Berkowitz from Israel 365 News. We really have an amazing opportunity here. We're going to be interviewing Judy Siegel-Itzkovich, who is our medical correspondent, and she's one of the journalists I respect absolutely the most, and she also has been reporting on medical news for over 30 years. And we're going to be asking her about the vaccine. Uh, I personally, as a journalist, have been horrified at the level of misinformation, disinformation, and non-information that's out in the world. Um, and I feel that my job as a journalist is to inform, to give more information. So we're going to be speaking to Judy, and we have a lot of questions from Judy. As I said, she's one of the journalists that I respect the most. Her journalistic ethics are of the highest standards. And also, if you look behind her, you'll see she's got lots of diplomas. She was covering medical news for the Jerusalem Post for over 30 years. She knows how the medical system works. She knows how to present the medical issues, and she knows what's to be said about it. So, Judy, if you could just tell us a little bit intro about where you stand on the vaccine and why, that would, I think, help our. Oh, I'm sorry. One more thing. If you disagree with us, I understand. Everyone is, of course, entitled to their opinion. However, in an issue that's this important, as I said, it's much better to have more information when it comes to your health rather than less information. So if you disagree, please feel free to disagree, but at least hear the information that Judy has to present.
And we are live streaming on Facebook, on YouTube, on Twitter, and on Twitch. And since this is a live show, you can write in your comments, and we will try to address as many comments as possible. So feel free to write in your comments.
Okay, so Judy, as we were saying, how do you feel about the vaccine? Do you feel it's safe, and why?
I'm registered with my health maintenance organization to have the vaccine next week. I'm not frightened at all. I have absolutely no worries about it. It has been used before, but the technology of Pfizer and Moderna, the technology of mRNA has been used for over a decade for other uses, for medications and all, and there were no complications at all. All vaccines that are given, and there are dozens of vaccines given to babies, also for to adults for various things, they have no side effects. None have shown any side effects after 3 months. They're safe. And there have been so many lies and urban
myths.
Yes, about vaccines for years. I remember about 25 years ago, the Black Hebrews who live in Dimona in the south said that it's dangerous to give measles vaccine, and they stopped. And when they stopped, there were dozens of children who got measles, and some of them died. And after this happened, all of them got measles vaccines, and they all survived.
So one of the concerns that I've heard a lot from our readers is they feel that the vaccine was rushed into production. A year is really fast for a vaccine to be put out. I think it's unprecedented. I could be wrong. And do you feel it was rushed into production?
It was rushed because people are dying like flies. 370,000 Americans have died. In Israel, it's 3,075, which is about 400 more than in the Yom Kippur War in 1973. So it was rushed, but it was rushed in a different way. It was the biggest scientists in the world all working together with unlimited budgets, which never happened before. They put their minds together, and that's why it's safe, even though it was rushed. They've tested it on tens of thousands of people, and there have been only tiny side effects of 2 people who are allergic in England. But so people who have very strong allergies shouldn't take it now. And it's in Israel, it's not given yet to pregnant women because pregnant women weren't tested at all, and children under 16 weren't tested. It's not because it's dangerous to them. So I'm not worried.
So you're saying that if they're giving it to you, it's because they know what your demographic is, and you've been tested. Your demographic.
Yes, I'm not worried at all. I'm not going to grow a tail, and I'm not going to grow a beard like Eliyahu. That's not going to happen to me because of this vaccine. I'm not worried. It'll hurt a little bit on the arm for a day or two, and maybe a slight fever, but there are no signs of any side effects that are serious. Really,
Judy,
people who had heart attacks, but had nothing to do with that.
Judy, there is a video that went viral. I'm not sure that you saw it, about it was a nurse in Tennessee, and 17 minutes after she was vaccinated, she got up to the podium to speak about her vaccination, and she passed out on live TV at the podium. While she was speaking, she got dizzy and she passed out. There's another 4 cases in a Chicago hospital in which the Chicago hospital stopped giving the vaccine to their staff because they started to have some sort of reaction to it. So there are reports out there of reactions. Are you saying that those should be discounted?
The woman who fainted probably was nervous. People faint for all kinds of reasons. Nobody in Israel has fainted. Today in Israel, last night the prime minister got his, and the health minister got his. And this morning, more than 80,000 people registered to have it done this week. Most of the doctors and nurses and other staff in Israeli hospitals registered today, and they're queuing up to get the vaccine. They know what they're doing. They know how many have died.
I actually read reports about the medical worker who fainted, and it turns out she has a tendency to faint personally. So it wasn't a reaction to the vaccine. It was more a reaction to getting an injection.
No.
So that also, people are wondering, are you familiar with the contents of the vaccine? People are concerned about fetal and genetic material.
Absolutely not. The mRNA mechanism is based on a molecule that stays alive for just 3 months. After that, it evaporates, and during the time that it's active, it goes into another molecule. So there's no danger at all of it having a long effect. We may have to be vaccinated against corona every single year, like the flu, because it may lose effectiveness. Nobody knows yet.
So Judy, there's a new strain that is very, very, very strong that is now being reported in England, specifically in London, where there is a lockdown across the city because of this new strain. And also, I don't know if you're following it, but there are many Israelis that are coming in from the UK to Israel, back from the UK. They're being stopped and they're being forced to be put into hotels, Corona hotels, and many of them are objecting to it. So there's a whole thing going on now. Do you have any? Well, first of all, do you know whether this vaccine incorporates all the different strains, or is it just a specific strain?
They believe, they don't know for sure yet, but they think that it covers all the mutations. Nobody knows how many mutations there are, but it's like a family of diseases, just like with the flu. There are various strains, and every single summer, it's summer here, and in the southern hemisphere, it's winter. And there, the World Health Organization decides which strains. So it's not new to us that there are different strains. They cope with it very well with the flu.
Have you heard anything about forced vaccinations or programs that would in some way, like, for example, limit your travel or limit your life in any way if you don't get vaccinated?
At first, the health ministry in Israel thought, well, maybe we'll force them because it's such a danger. But they quickly realized that if you force somebody, then they'll refuse to do it. Israelis are like that. And besides that, if you give them incentives, for example, every time when people finish the 2 vaccinations, they will get a green a document that's like a green passport, which will allow them to travel abroad without being tested, and they won't. They could go into movies or whatever is open without being isolated and all. So they're great benefits to getting this vaccine.
Can you tell us a little bit about herd immunity? I heard the head of the Ministry of Health speaking about how they estimate that 10% of Israel today has already gotten the coronavirus, and that they hope to vaccinate 5 million others, which will create this herd immunity. First of all, are there enough vaccines to go around to do that?
It's not 10%. There have been fewer than 400,000 Israelis who've been infected. There may be some asymptomatic that we don't know if they have or not. But in Sweden, they said from the beginning they would do huge herd immunity, that everybody would infect everybody else and everything would be fine. But it's not true. In Israel, they want to vaccinate at least 60 to 70% of our population, which is 9 million people. Since children can't be vaccinated yet, but they probably will be vaccinated later, and pregnant women not, and people who have very severe allergies, so it won't be 9 million. But Israel has done very well in getting the various companies to agree to supply vaccines, so there'll probably be more than necessary. In Canada, they ordered vaccine more than 5 times the population, which is crazy. And then there are poor countries where fewer than 10% will be covered. So they'll continue to get sick and maybe die. So I think it would be a good idea if the countries with plenty of vaccine donated their extra vaccine to the poor countries.
There's rumor that Israel is trying to produce their own vaccination. Do you know anything about that?
Nais Ziona Biological Institute, which is connected with the Defense Ministry, started early. And they've been developing it, and they're only in phase 2 studies. They're not yet in phase 3 or beyond that. So there's a big problem with this vaccine. Because when they give clinical trials, when they try it on people, they have a placebo. They have half of the people get the vaccine and half of the people don't. And the doctors and the patients don't know who gets it. So since today, Israelis will be able to get the vaccine from Pfizer and from Moderna, you have to be a bit not normal to say, okay, I may take the placebo and endanger themselves. So they're very worried at the Biological Institute in Israel whether they'll have enough people who are willing to be tested.
I want to just reiterate, Judy she has a lot of good information. And if you're going to make a decision this important, even if we're not trying to change your mind. We're trying to give you the information that you can make the best decision for you and your loved ones. So please don't feel like we're saying, oh, you're wrong, you have to think like we do. We're giving you information, and a responsible person in times like these will consider all the information. And that's what we're doing here. I'd like to reiterate that.
It's very important to understand that if people get corona, people say, okay, let's have parties. Just like in America, they used to have parties to get chicken pox, and then we'll all get it and everything will be fine. But it's not true. If people get corona, there are terrible side effects. There are people whose hair has fallen out. There are people who got insomnia and can't sleep more than 4 hours a night. There are people who have lost half of their hearing. There are people who are in such weakness that they're unable to get out of bed. So even if people don't die of corona, they can suffer. They can't smell and they can't taste, so food has no importance to them. So it's no joke getting corona. It's much better to prevent it rather than to get it and then to suffer from side effects of the disease itself. It's much more dangerous.
Okay, Katrina, she wrote, it does not prevent COVID. It prevents you from getting it as aggressively, and you can still get the virus. Is that accurate?
No, that's not true. 95% of those who were tested, and it's tens of thousands, did not get any infection. But those on the placebo who didn't get any vaccine, large numbers of them got the corona.
I also want to point out one of the, unfortunately, the media in general has been out of hand in the last couple years. But even with this issue, which is a medical issue, why should politicians be weighing in on this on such a level? Why did it become so politicized? And this politicization leads to just absolutely horrible flow of information. So I think listening to someone like Judy is very, very important. We're not, as I said, we're not trying to convince you. We're just trying to present you with information, which is something that hasn't been done lately. So Judy, someone asked, do you advocate for getting the vaccine?
I'm going to do it myself, and I've told all my children and my grandchildren, and they're going to be vaccinated. There's no question about it. No question.
Israel is, they're prioritizing which into production. On the other hand, it's been so quick that they haven't had chance to produce quite enough. I'm 59 years old. I have type 2 diabetes, and that puts me in a danger group. So even though I have, honestly, sincerely, I have reservations, when I'm in a group that's considered at risk, I'm going to think more than twice about it. Even though I have reservations, I'm going to be seeking a lot more information than I had last week. Just because it's not, I actually, a lot of people say they haven't met anyone. They don't know anyone who has COVID. And to be honest, I only met someone recently, a father of one of my daughter's friends. And I spoke to him, and he said, no joke. He said, I said, you hear a lot of, and he's like, no, it was real.
There were a number of...
My first cousin is a social worker in New York, in the Bronx. She got it, and she felt terrible. She lost her sense of smell and taste, and she was very weak. Her husband is an anesthesiologist at New York University Hospital. He also got it. It's terrible.
Oh, really?
It's no joke. I know doctors in Israel who got it. I know all kinds of people who got it, and they suffered terribly. Eli Beer, who's the head of Israel Rescue, he is in his late 40s, and he was on an ECMO, which is a machine in Florida, a machine that takes over for your lungs and heart. And he was attached for weeks, and he was anesthetized. He wasn't aware of what he was doing. He almost died, and now he's better. And he says, no question, he saves lives all the time with first aid people who volunteer and go around on motorcycles. He's an absolute advocate. He knows what he's talking about because he almost died from it.
There have been a number of polls that have come back out in Israel about people that are suspect of the vaccine, and they say they want to wait a little bit longer before they get it in order to see what the results, what the reactions are to it. A good portion of Israelis are a little bit concerned and saying that they want to wait to see what's going to happen further down the road. And the rabbis, I wanted to point out also, it's not clear across the board that the rabbis are supporting it. Some of the largest rabbis, the former chief rabbi of Israel, Rabbi Lau, got his injection today. Some of the greatest rabbis in the Haredi and the ultra-Orthodox community have also endorsed it. But on the other hand, you have some Hasidic rabbis like the Am Shanova Rebbe who has come out and said not to get it. Any comments about those endorsements?
I want to, if I can preface your comment. Keep in mind, Judy is a very devout Jew, and she comes from a family of devout Jews. So when she gives this answer, it won't be a secular person commenting on religion. This is a person who takes her religion quite seriously, something I respect enormously.
I'm the daughter of an Orthodox rabbi. I come from a long line of rabbis, and my children are all Orthodox. There's no question. According to Judaism, it's v'nishmartem od lenafshotechem. You have to be, that's in Hebrew, that you have to be very careful about things that are not doing anything that harms your health. That's why it should be, or it is, prohibited to smoke because it kills people all around the world. You shouldn't smoke. You shouldn't do all kinds of things that are dangerous. Take drugs or opiates or whatever. health is the most important thing. So any rabbi who comes out against something that will save people from death, I don't understand them at all. They're either ignorant of the facts, or there were also rumors which are totally ridiculous that taking the vaccine would lower people's fertility and they wouldn't be able to have children. It's absolute garbage.
Okay, Wendy wants to know if Israel has the same vaccine as America.
We have the Pfizer vaccine. It comes from Michigan, the supplies we have. And we are going to have enough supplies for every single Israeli. Plus, we will probably donate vaccine to the Palestinian Authority because we're neighbors. And also, we could easily, they come and work here, so we could easily get infected from them.
Exactly. This is something that shows our interconnectedness with our fellow man.
That's right.
Absolutely. And as I said, I'm going to emphasize this. If you hear something here that you don't like or that you don't agree with, rather than cancel out and or silence people, especially in this kind of issue, it's so important to hear the information, to process it. And if you're a thinking individual, you should hear it and you should take it in and make your judgment. And I can't emphasize that enough. I'm trying to think of the. So, what do you think of the prospects of the government tracking people for contact tracking?
They tried that, but they weren't very good at it, even with the help of the army, because many Israelis were found to not tell the truth or to lie about how many people they met, and it wasn't working. It really wasn't. So they're stopping it. And anyway, the vaccine is here, and that's going to bring an end to the pandemic.
God willing. So what do you think it'll look like after the vaccine? If the vaccine, if more people take the vaccine and the vaccine is accepted, what do you think it'll look like? I mean, right now we know what they call the new reality, which is not what I grew up in, and I see it affecting my children, and this is not a good way to live. You know, where you're stuck in your house. My kids can't go to their friends. They had difficulty until they were going back to school. Unfortunately, so many people are tragically affected with their income and providing for their family. What do you think how do you think the vaccine will affect all that?
For about 4 months, we'll still have to go wear the masks and try to separate from each other, at least in crowded places like theaters and movies or whatever. Not because the people who are vaccinated will be harmed, but because they don't know yet if people who are vaccinated could still give the virus to somebody else. So it's just a precaution. After we stop wearing the masks, life will pretty much go back to normal, we hope. The working places and the shops and the malls and everything, they will open, and I have no doubt things will return. But because so many businesses are failing, restaurants and all kinds of things are failing, so the economic situation will not recover very quickly, and the job situation, it could take a long time. But I want to make it clear that this is not the last pandemic that the world will see. There was a huge Spanish flu that came from the United States in 1918. It killed tens of millions. But today, the situation is much worse. In the East and other places, there are people who live with animals, who easily, they're zoonotic diseases in which they jump from animals to people. And because the human beings are crowding out the animals, like bats and all kinds of animals, and they eat them as well. So there'll be more and more diseases going from animals to people because there's less room in their natural environment. So we have to be prepared to cope with more pandemics like Corona, I'm afraid to say. They have to bring more experts on public medicine, more people who are epidemiologists, more people, scientists who will find solutions. But we're not finished with pandemics, by no means.
Okay, we're going to wrap it up now. Judy, I really can't thank you enough. You gave us a lot of very important information. If anyone has any questions that they want for Judy, or if they have someone they'd like us to interview to ask their questions, you can email me at Israel at Eliyahu, Eliyahu at Israel365.com. And I'll try to get your questions answered. This is not the last time we'll be talking about this subject on our broadcast, because this is hugely important. And as I said, we just need information because there's been no information out there. I'd like to thank you for joining us. Judy, you're the best. I really appreciate it. Thank you so much.
Okay.